Hello and welcome to the fourth and final part of this training series developed in collaboration with the Trauma Dissociation Study Group India, Therapeutic, Psychological First Aid, Creating a Buddy System Network. I'd really like to thank again Aditi for all her input, her support, and for making it possible to share this training with you all. Before I begin the training, I would like to acknowledge the traditional owners and custodians of the land from where I'm broadcasting, the Gadabanud of the Eastern Maar Nation, and to pay my respect to elders past, present, and emerging. In part 3 of the training, we focused on self-care, individual self-care, the kinds of things that it's important for you as individuals to be mindful of, to pay attention, and to offer some strategies of things that you can do to support yourself, not only during this very challenging and difficult time of the COVID-19 pandemic, but in this work, in our work generally, taking care of ourselves needs to be a number one priority. It's as important, it's equal to the care that we provide for our clients. In this part of the training, in this final one, we're going to be looking at taking care of ourselves from another perspective. So we're going to be looking at organisational considerations, how organisations can support and take care of their employees, but also for those of you who are in private practice, because I know that there's a real blend of people who've been doing these trainings who work in private practice, and those of you who work in organisations, whether it's hospitals or schools or mental health clinics, that the things that I'm going to be talking about today can be applied to both big organisations as well as people in small private practices, even when you may be a sole practitioner. So we'll be looking at how you can create a network of people that are interlinked, where you can be looking out for each other. So we'll start off with the organisational considerations, and then we'll look at within that what's going to help at an interpersonal level. What do we need to be mindful of, aware of with our colleagues, and how can we look out for them and support them without taking on like a counselling or a therapist role with our clients, with our colleagues, like as if they were clients. How can we look out for our colleagues and support each other and see that we are, we're all interconnected and we're all responsible for not only looking out for ourselves, but also noticing when we might have a colleague who is struggling for whatever reason, and the things that we can do to connect with them and assist them to take care of themselves. And this will move us into looking at buddy systems and adapting the idea of buddy systems to this particular situation. And then we'll finish off with how psychological first aid, the concepts within psychological first aid, can be applied to a buddy system network. So let's begin with looking at organisational structures and what are the obligations, the responsibilities and duties of organisations to be taking care of their staff. Because when stress is unrecognised or ignored, we see the impact of this right through people's professional lives as well as their personal lives too. So for a start, we might find an organisation experiencing a very high turnover of staff, or people going on stress leave because they're overwhelmed with their duties, their responsibilities, the impact their work may be having on them. So if it's no other reason other than at a purely economic level, it makes sense for organisations to be putting in place structures and strategies to take care of their employees, because in the long run, it's going to be more cost effective for them. They're going to have less people leaving, they're going to have, and then having to recruit new people, which obviously takes time and money. And of course, when people leave, they also take away their knowledge, their professional knowledge and their skills, and also their knowledge of the organisation. So organisations are going to be, better served if they are also serving their staff. And of course, stress leave, we know, I'm not sure what the situation is in different organisations in India, but stress leave can be a very big expense for organisations. We also see clinicians having difficulty with their clients. I mean, which makes sense. If we're overwhelmed, if we're stressed, if we're not operating to our optimum levels, then it's going to create more difficulty in our interaction with our clients and also with co-workers as well. The kinds of personality frictions that you would expect in any organisation. It's not an expectation that everybody's going to like each other and get on with each other fine, but what we would hope to be able to achieve within an organisation is that people can work together well enough, be cooperative, be respectful and supportive of each other, even if at a personal level the people that they're working with are not necessarily people who they would choose to spend time with outside of the workplace, which is absolutely fine. But those stresses, when they're ignored or they're not being recognised, aren't going to just stay within the workplace environment. People are going to take them home, and this is where we see relationship difficulties with children, and of course health issues. We know that stress that is prolonged, that is unrecognised, can develop into chronic health conditions. So it's important to be dealing with stress and finding ways within organisations to support staff so that all these kinds of issues are going to be minimised. It's not, there's not an unrealistic expectation that people will never go on stress leave or there will never be conflict between staff members. But what we want to do is to create an environment where those kinds of issues are not only reduced, but they can be identified and addressed sooner rather than later. For those of you who are in private practice, you may think, okay, well, look, this doesn't apply to me. I'm my own boss. I can, come and go as I please. I can make my own schedule. I've got all this autonomy that I wouldn't have if I was working within an organisation. And of course, that's absolutely true. But there is also, a flip side to that as well. Like in any situation, it's 6 of one, half a dozen of another. And of course, different people are going to be drawn to and will suit different types of work environments. But if you are in your own practice, you, as well as all those things that we might think are tick, tick, tick in terms of being your own boss, there are also more responsibilities and liabilities when you are working on your own. It rests on your shoulders as opposed to an organisation. And of course, working on your own, and particularly this is something that I'm hearing a lot here in Australia from some of the people that I'm doing case consultation with who are in private practice, is that there is an increasing sense of isolation because here we're going in and out of lockdowns. People are still doing a lot of work via telehealth, and of course the unpredictability of when you'll be able to see clients in face to face, and when you're going to go into lockdown. And and I'm sure that in different parts of India you've been going through all of these issues, and tenfold than we have here in Australia. And so when you're working on your own, it can be isolating, and of course with the increased stressors that the pandemic is bringing to everyone, it might feel overwhelming at times. And of course, the other thing is, it's not just a question of being a good clinician and doing professional development training so you can learn new skills, so that you can find the best ways to work with and support your clients. You're also needing to develop other skills too, in terms of developing business skills, marketing your practice, managing taxes and finances, all those sorts of things that you don't have to think about if you are working within an organisation, because those things are done by other people within an organisation. And of course, if you're in a situation where you are wanting to expand your practice and bring on a new associate, then that's going to also be another demand on your time, making sure that you can offer your associate the kind of supervision and support that they need, as well as if you're perhaps bringing in administrative staff as well. So it may be sort of like 6 of one, half a dozen of the other, if you're in private practice. And so if you think about a private practice as being not just about the clinical work that you do, but also a business, it's helpful to then think about, and we're going to be talking about this in a moment, how you can apply some of the aspects of organizational structures to your private practice to help alleviate and mitigate some of the stresses that I've mentioned here. Now, whether you are working for an organisation, or whether you're working on your own in private practice, or maybe with a couple of colleagues, everyone is going to be experiencing additional stressors during this pandemic. There is an increased demand for services. So people who previously had not made any contact with a mental health professional prior to the pandemic are finding themselves in situations that they have are totally unexpected and unprecedented for them, and reaching out for help and support, and often in really quite stressing and traumatic situations if they've had illness in the family, whether that's COVID-19 illness or other illnesses during this time, which has made treatment more difficult to access. And then, of course, people who may have lost loved ones or are in the process of losing loved ones as a result of the pandemic. So there's increased levels of stress and fear and anxiety through all our communities. And of course, that is going to be reflected in our own stress. We are going to be experiencing increased stress, fear and anxiety due to the pandemic, as well as the people who are seeking our services. And of course, all of us, and depending on where you are and what the particular health guidelines and restrictions that may be in place wherever you are living, but at different times we're all going to be experiencing increased isolation if you're in lockdown, or there are other measures in place that mean that you might not be in lockdown, but you can't mix with and meet people in the way that we have been used to prior to the pandemic. And of course, people are using Zoom and phone much more during this crisis as well. I think we've all had to kind of like, speed up our skills in how to have a Zoom meeting, or to do training via webinars, rather than being able to meet in person and speak directly to the presenter, speak and network with your colleagues during the breaks. All those things that are so important in terms of not just our professional development, but also that sense of connection, of belonging to a professional community where we can exchange ideas and feel supported, and build up a network of people who we may be able to draw on their particular skill and expertise at different times. And so when we're using Zoom constantly, there's a change of dynamics in our interactions with each other and and with our clients. Certainly, people who I'm doing case consultations with have talked about the big challenges that they have experienced with clients of adapting to just seeing their face on a computer screen, and how much harder that can be to be able to kind of read the room, assess what's happening moment by moment with a client, because it's not the same as physically being in someone's presence. And actually, I was doing, before I started this training, I was giving a case consultation to someone who was saying that a client of hers who began telehealth sessions in the beginning of the pandemic, when Sydney went into its first lockdown last year, and has continued with telehealth sessions, even though for great chunks of time, months at a time, Sydney has been out of lockdown. It's currently back in lockdown, but for a long time it was out, and there was the opportunity for this woman to resume face-to-face sessions, but she has chosen to stay with telehealth. And we were kind of wondering and curious about whether there was something around the telehealth sessions that was helping her feel perhaps a little bit less overwhelmed, or it was helping her to manage her internal dysregulation by having just someone on the screen rather in the room in front of her. So I mean, there's all these change of dynamics that we experience with just having Zoom contact with people, or over the phone, where, I mean, at least with the Zoom consult, you can see the person's face and you can, get a sense of their body language and what might be happening. On the phone, all we have is, is someone's voice. And of course, we also have clients who are very adept at being able to put on, a front, and we don't necessarily know just from what they say or the tone of their voice what might be happening for them. And so it makes our work a lot more challenging. And of course, from time to time, we also will have technical issues where, we kind of, it could be the equipment's fault, of course, it could be the equipment's fault, or it could be our own unfamiliarity with, with certain technologies, and that can be stressful in itself when you don't know how to make things operate. So these are all the kinds of additional stresses that we're going to be experiencing during this time, on top of what is already very challenging and demanding work. And so looking at organizational culture is really important. And this is where, organizations can look at what their mission statements are. I mean, often, if you go to a company's website and you find their mission statement, and it sounds great, and then you get into that organization and you start talking to people who work there, and you get either overtly or implied, it all looks very good up there on the website, but that's not actually what's happening within the organisation. So it's so important that organisations walk the talk. It's not just a question of saying the right thing in terms of what the organisation's values are, their policies are, their commitments to their staff, to their clients, and the whole organisation. But they are actually doing those things. They are walking the talk as well. And so we want to be looking at things like how much and in what way is the organisation creating space for their people to have professional development training and also supervision. And one of the things that I think that's really important to be thinking about with organisations and supervision is, from my experience of going into different organisations here in Australia, I know that policies and procedures and organisational structures are constantly changing and evolving, and that staff have no sooner got their heads around and are working with a particular structure, and then in comes a new manager or director or board, and they say, no, we want to change this around and we're going to start doing things this way now. And so sometimes those supervision times that have been set aside to actually work with team members to discuss cases of what's happening with their particular cases and how they're managing their caseload, can actually get caught up with a lot of those managerial and team kinds of issues, and looking at how policies and procedures are changing, and the support around the actual work can get sort of like pushed to the side. And so it's really, I think, important to separate out those two things, that if you're in an organisation where there are significant changes taking place, that those of you who are managers and supervisors create space for, this is the time where I'm going to talk to my staff, my team members, about these policies and procedures and how these are going to be implemented. And this is the time where I'm going to work, one-on-one with, with team members to talk about particular cases that they have. Also, it's important for organisations to really take the time to note and celebrate achievements and milestones and successes. I think that very often, an organisation can have a mindset of, well, as long as there's no big disaster happening, we're just going to sort of like keep on going, and everything will sort of like take care of itself. But we know that people respond better, that they work better, that they have more enthusiasm for their work and more commitment to their organisation when the organisation actually shows that they are valued and will make conscious efforts to congratulate teams, whether it's a team achievement or whether it's an individual within a team for work that they're doing, things that are being accomplished, and to really come together and celebrate those achievements and successes, as well as having the space to acknowledge mistakes that are made, but most importantly around that, without shaming, that, what is it, okay, this went wrong in this situation, in this particular team or with this particular client or family that we've been working with, what happened there? What can we learn and understand from this situation that should this sort of situation arise again, that we will have another way of approaching it, understanding it, and working with it. Because one of the things that I am acutely aware of in terms of my own professional development is how much I learned from my mistakes. And very often, and sometimes more, in the training that I give, I talk about the things that went wrong, because first of all, I want to to reassure people that mistakes happen. We all make mistakes. It doesn't matter how experienced and professional that you are, there are going to be things that go wrong. And so I think it's important that we are able to talk about those, to share those without feeling ashamed. I mean, obviously when things go wrong, we can have that feeling like, oh my goodness, I can't believe I said or did that, and I handled that in a really inappropriate way. They're normal responses, but within those responses, rather than sort of like getting stuck in shame and feeling that your organization is looking at you as though your competence is being called into question, we can say, okay, let's stand back from that. What is it that I've learned? And there's a lot of things that I have learned from the mistakes I've made, as well as the things that I've done that that worked out. Another thing that I think it's also important is to be aware of the unspoken norms that can develop within an organization that can undermine the intended culture. And this is the disconnect that I was referring to between what a company's or an organization's mission statement might be and what the actual experience and the expectations might be within that organization. And it's very easy for organizations to kind of develop an unspoken culture, which might be something like, oh, we just get on with it here, we don't make a fuss. It's like, you take it on the chin when things go wrong, and just get on with the job. We haven't got time to gaze at our our belly buttons and ponder life. We need to just sort of like get on with the job. And I think that kind of unspoken culture and expectation can be very undermining and erode people's confidence in themselves, but also their sense of confidence and safety within their team. If they feel that they cannot raise issues with their colleagues, with their managers, supervisors, team leaders, whoever, it then sort of like pushes those issues underground. And as we know, that when things are pushed underground, they tend to just sort of like fester and bubble away underneath the surface until they erupt somewhere further downstream, and the issue may be more problematic than if it had been addressed very early on in the piece. So keeping systems open within the team, as transparent as possible, so everyone knows where they fit in the team, what's happening at any particular moment in time, which will create more of a sense of connection, and that we are really in this together and supporting each other. So how does this apply if you are in private practice, whether you're a sole practitioner or maybe you're in a small practice with 2, 3 other people? Well, what I would ask you to sort of like consider is to think about the work that you do, that your private practice as an organization, as a business, which it is a business, and to think about what are the terms of self-employment that you have set for yourself. What are your occupational health and safety policies in place? What are the risk factors that you have considered working on your own, whether that's just exclusively on your own or with a couple of other people. What are the hours that you are working? What are the wages that you are paying yourself? What about leave? Are you scheduling in a specific amount of leave, on an annual basis? And not are you just sort of like scheduling that in, but are you taking it? And also sick leave too. I mean, for people who work within hospitals and schools, there will be some mechanism in place that where if you need to take sick leave, then there will be some financial support, even if it's not your full wages. There will be something in place that supports you while you take time off work. When you're working for yourself, the only person who's going to be paying you any sick leave is yourself. Are you factoring that in when you think about how much you're charging and the wage that you're paying yourself, that you are factoring in, I need to be earning enough to not only cover me on a week-to-week basis, but also to cover me for X number of time I'm going to be taking for for holidays, and to cover myself should I get unwell, or should I need to take some time off to look after a family member, and that those things are factored into your business model, and not just a question of, oh, well, to meet those, then I just have to increase my hours, which I think is very much a temptation for people who are in private practice. And also, are you getting regular supervision? I think this is, such an important thing, as well as professional development. And of course, these are additional expenses when you are working for yourself. But also, I think that it can be a bit of a false economy to be telling yourself, well, I don't need to prioritize these things, supervision and professional development, as much as if I was working with an organisation and they were contributing to my professional development and supervision sessions. One of the things that I'm again have noticed over the years, providing case consultations for people who are in private practice, who are working with very complex trauma cases, is that they will sometimes let a situation go for longer than is helpful in terms of seeking out consultation, and financial considerations has been part of that. And then by the time they contact me to discuss a particular case, things may have got far more difficult and complicated with that client than if they had perhaps made a time to chat about that particular situation earlier. So make supervision and professional development a priority. Of course, that means really, I think, for everybody, whether you're working within an organisation or whether you're in private practice, the need to really sort of like think about where are your, is your hard-earned income best spent in terms of the type of training that you do. There is so much out there, that just the choice can be overwhelming. But again, this is where connection with your colleagues can really help, where you might come into contact with someone who says, look, I've read a really good book and it's changed the way that I think about and work with this particular client group, or I did a particular training and I just think that it was, I highly recommend if you get an opportunity to do training with this person. This is part of the networking benefits that we can gain from staying interconnected with each other. which then brings us into the next part of looking out for each other, taking care of each other, is what we do at an interpersonal level. And so this is really looking at relationship management. And of course, this, this particular slide or diagram is describing situations more that were perhaps relevant in an organizational structure. But as we move on and we start to look at setting up buddy systems, whether you're working within an organization or whether you are in private practice, these kinds of behaviors or relationship strategies are going to be equally applicable. So in the same way that we want to model to our clients effective ways of relating, of communicating, of being in the world, we also want to sort of like model that with our colleagues as well. We want to create a sense of collegial support, of interest in what our colleagues are doing, helping them, work through particular difficulties they may be having, whether it's within, an organizational issue, something with a particular colleague or manager, or with a client, of course. And this is about treating people with, with warmth and respect. It's also about, addressing those stresses and strains and conflicts between team members, which can be difficult. And of course, some people feel more comfortable to raise issues than others. And, we've all, seen that in meeting situations where very often the same people are the ones who will speak up, and other people may sort of like hold back. And so what can we do in those kinds of situations where we notice that? And that is, if you are someone who is more comfortable speaking out in a group, to notice those who may be less comfortable. It's not that they, don't necessarily have any ideas or things to contribute that would be really useful, but maybe they just feel less comfortable in a group situation. So finding ways to bring those people into a conversation, asking their ideas, their opinions. And it might be so that, because some people are very shy and they may feel put on the spot if someone asks them, oh, and what do you think? That might feel very difficult for some people. But if you've had conversations with someone in a private capacity where you've been talking about things within the organization, or whatever it might be, turning to that person, I'm just trying to remember, there was something that you said when we were meeting, when we were talking the other day, that I just thought was really just spot on. It really sort of like, hit the nail on the head, and try and encourage them to then contribute in that way. Also, I think it can be very helpful engaging in non-work activity with the people that we work with. And again, it's not about trying to just sort of like, be friends with everyone. It's about more creating an atmosphere where we can feel more relaxed with each other, and to also take some of the pressure and the stress off those sort of like, everyday issues that are going on, whether it's with clients or whether it's something happening within the organization, or both. And so, I mean, that can be things like, acknowledging someone's birthday if they're happy for, for that to occur, and, and having a cup of tea together, a birthday cake. Obviously, if you're not working on site, at the moment, it's all in your sort of like connecting with each other by Zoom, getting together for Zoom meetings that are not just work focused. And this is one of the things that I've been talking about with one of the law firms that I work with here in Melbourne, is to encourage that you get together, you know, whether it's once a week, once a fortnight, whatever is going to work for that particular team, where you all get on a group Zoom and just chat about something. Stop work, have a cup of tea, have, you know, a snack there, and just sort of like talk about what's going on, checking in with each other. And to identify those people that you feel would be, you would feel comfortable going to, if you are feeling, you know, overwhelmed and feeling that you need some support. It's also about being promoting accountability, peer accountability, checking in on people to see if they're, you know, they're stopping for meal breaks, you know, they're taking for a walk, they're getting away from their computer screens and getting out into, you know, the open air, you know, in whatever safe way you can do that. So really kind of just sort of like checking in on each other, you know, how are you going? You know, are things okay? You know, you taking break. I've noticed that when I've tried to contact you on Zoom, that, you know, you're often really sort of, you know, busy for hours on end, and I'm just sort of like wondering whether you're actually getting any sort of like break. So I'm a bit concerned about you. And also encouraging discussion about the impact that your work is, you know, is having, not the content of the work. And I think this is really important. We're going to be talking about this in more depth when we look into psychological first aid. So not encouraging people to sort of like go into details of some of the stressful situations that they are dealing with clients, but how is that work impacting them, and letting them having an opportunity to share what some of those impacts might be, and you know, offering some support and guidance around, you know, what might help them if they're feeling so overwhelmed that they're, you know, they're not thinking of those things for themselves. So it's really about creating an environment where you are looking out for each other. You're modeling the kind of behavior and the kind of concern that we have for our clients, and we're sharing that for and offering that to our colleagues as well. And it's also, I think, allowing people to just have normal human reactions, and that you know, to feel overwhelmed, to feel upset, to feel like you know, you want and need to have you know, a good cry, or that you need to vent some anger and frustration, that these are normal human emotions and responses to situations that can be very difficult and challenging, and also you know, certainly with the pandemic, there is, you know, ongoing uncertainty about when these situations will begin to change and settle down. And to also recognise people's strength and resilience in all of that. We don't want to negate the impact that they may be experiencing from their work, but we also want to acknowledge what they're good at and what skills and talents that they have, so that we can help, you know, someone who's maybe leaning over a little bit like this, feeling weighted and burdened by things, right their ship a little bit and get some perspective on what their capacities and their inner resources might be. And also in terms of an organisation, it's very important to that the organisation makes it very clear and easy and apparent how staff members can access support should they need it. So we don't want complicated systems and policies and procedures in place that if someone is in a really difficult crisis situation, or even before it gets to a crisis situation, that they have to navigate their way through tons of paperwork and approvals before they can access some support that might be useful. Which leads us now into looking at setting up buddy system networks. And buddy systems, some of you might be familiar with the term buddy system, and others of you might not be. So I'm just going to give a very brief outline of what buddy system networks are about. And lots of organizations use buddy systems or types of buddy system networks, even if they don't call them buddy systems. And it's like a safety management practice where an organization will pair up two people within the organization where they are given responsibility for ensuring each other's safety. It's your job to check in on each other and make sure that you're okay. And this is usually, an arrangement where both parties are in agreement to, being involved in this kind of support network. There's no point in I think pressuring and pushing people to be part of a buddy system network if they don't want to, because that will kind of set it up to fail from the outset. So we're really looking for people who are open and would welcome that kind of support. And so often these are systems that are set up with new employees who have more experienced staff assisting them, but it can also be adapted to other situations. And I think that this ongoing pandemic situation really calls for us to explore new ways that we can assist and support each other over the longer term. And of course, if these systems are put in place now, they can perhaps sort of like thrive and grow and develop after the pandemic and be just something that is, that an organisation or a private practice, people in private practice do as an ongoing way of taking care of each other. So to set up a buddy network, first of all, you need to decide what's the framework of this network that we're thinking about setting up, and what's the purpose of it? What are we aiming to achieve through setting up connections between each other? And to also then think about what are the organisation's obligations to their employees, that whole issue of looking at rights and responsibilities. And so setting the expectations of the people who agree to be part of a network, what is going to be expected of them if they join this sort of like program. And so surveying your organisations is going to be really important for that, to put some, maybe, it doesn't have to be a very elaborate position paper or anything. It can be just sort of like a few paragraphs around acknowledging the increased stresses on everyone during the pandemic, and that the organisation is very keen to to look after its people, to make sure everyone is getting sort of like support and help should they need it, and that this is going to be a voluntary program that people can join, where they can be connected with people who are at a similar level to them. So you're looking to work with peers, managing, connecting people who are at the same level, and to just see what their needs and interests are, to see what ideas come out of the organisation, and then from that, from the feedback and the volunteers who are saying yes, I'm interested to know more, then you can perhaps sort of like have meetings, whether it's by Zoom or however, whatever is the most effective way or possible way to to talk about it, and then begin the matching process of who is going to be whose buddy. And I think the important thing, or one of the really important things around setting up a buddy system, and what's the purpose and the expectation of that system, is really being clear that it's not an alternative to supervision. We're not saying that if you've got a buddy system in place in your workplace, then that means that you don't have to have or need to have ongoing regular supervision from your your manager or team leader, or whether it's external supervision. This buddy system network is something that sits completely outside of a supervision framework. And so once you have got that framework in place of what's the purpose of the buddy system, how's it going to operate, who's going to be involved in it, what are we going to try to achieve with this, then you've got to look at then how are you going to connect people with each other. And again, that will really depend on whereabouts you are and what the the health requirements and restrictions might be in the particular area that you are. If it's possible to meet face to face, then always, then that's fabulous. But there's going to be a lot of situations where that's not possible. And also, if you're connecting with people who may not actually be working within your physical building, you might be in the same organisation, but they could be in a suburb or a city a long way away. So face to face isn't always going to work. So then you might think about, is phone going to be the best option, or having meetings via Zoom? So how will you connect? What's the frequency that you're going to connect with each other? And again, there's I'm not suggesting that there is a particular frequency that is better or not. It really depends on what the perceived needs are within your organisation. And I think the thing is also to think about, how can we make this meaningful? We don't want a situation where it just becomes or feels like, oh, it's another thing I have to do. I've got to, it's time I've got to contact my, my buddy and check in if they're all right. And, you get on Zoom or you get on the phone and, how are you going? I'm all right. Or, how are you going? Oh, I'm all right. We don't want it to become just, another thing that feels like it's just sort of, a burden, and it's not really contributing to your your health and your well-being and your sense of connection with people. So how can you make it meaningful, this kind of connection? And this is really only that you can decide between you and your buddy, is what will make this a helpful connection for you, what's important to you. And I think it's about recognizing that there needs to be flexibility and adaptability built into the connection with your buddy. That over time things will change. Each of your needs will change. At one time, one of you might be traveling along really quite well, and the other one's not. So having that kind of flexibility to meet each other where you're at, so that it makes it meaningful, not a burden, not a sense of sort of like duty in a heavy sense, but this is a responsibility that I think is really important and meaningful, and I'm committed to this. Which, when we think about how can we make this meaningful, there are some things that we can take into consideration that might help us frame what's useful, what might help, and what this connection is not and we shouldn't try and make it be. And this is where thinking about psychological first aid can be useful. And I raised psychological first aid, I think it was in part 1 of this training series, to think about that in the influx of people that you will be seeing coming to your practice or your service, there may be a certain proportion or percentage of those people who don't necessarily need ongoing intense therapeutic support and interventions, but may benefit from some psychological first aid. And so this is also something for us to consider with setting up buddy system networks too. So we know that in terms of resilience, people being able to maintain their resilience and enhance their resilience, that there are certain things that will really facilitate that. And that if people feel safe, connected with other people, which of course is what the buddy system is aiming to do, remain calm and hopeful, these are key ingredients to developing and maintaining resilience. Now, of course, during a pandemic, it's really a game changer, isn't it, in terms of feeling safe, connected, calm, and hopeful. Where psychological first aid is often used is in immediate disaster situations, like an earthquake or an avalanche or a flood, those kinds of situations where the trauma, the disaster, the critical part of that can be quite short-lived in terms of the actual event or events that take place. The healing from that, the rebuilding and moving forward with that obviously can take a lot longer. But we kind of see a trajectory in those kinds of disaster situations. The sort of like the first impact of it, getting all services and supports in place for people that need them, and then looking at what people might need over the longer term. Whereas with this pandemic situation, it's a different ball game because we don't know when it's going to end. And so the crisis is ongoing. It's a rolling crisis. And so people feeling safe and calm and hopeful is perhaps more challenging because it's coming and going. It's settled down, and then it rears its head elsewhere. And that sense of safety, that when we think about external safety in our environment, is really quite compromised at the moment, where you can't see the virus, you don't know where it might be, you don't know that person that you passed on the street may be infected, whether you have been exposed. And so what we want to do is to try and help as much as possible within these constraints of a pandemic to have access to social, physical and emotional support, to assist people to regain a sense of control, to be able to help themselves as individuals as well as their communities. So we're going to look at what psychological first aid is, and then we're going to look at what it isn't. So it's non-intrusive practical care and support, checking in, what's happening with someone. Is there some service, or is there something that I can do or assist you with, or connect you with someone who may be able to assist with a particular issue that is happening in a person's life, and being able to really assess what those needs and concerns might be. So in a disaster situation, it will be about addressing those kinds of basic needs of shelter, clean water, access to resources like food and finances. But it's also about listening to people talk about their experience, giving them, you know, a space where they can just talk about it, what they're experiencing, what they're thinking and feeling, and comforting people in a way that is not taking away or trying to minimize, oh, look, it will all be fine soon, no need to sort of like worry, but just comforting people by acknowledging, yeah, it's a really, really tough situation, you know, right now. And, you know, it's okay, look, I'm here, I'll sit with you, we can talk, so that people can, you know, begin to calm down, and helping them to connect to the information services and supports that they might need. But what it's not is, it's not professional counselling, and it's not psychological debriefing. And I think it's really important that we are very mindful of that, because I'm talking to people who are mental health workers, and that's what you do. You counsel people and you debrief people. We need to be very careful that we don't cross over a line with what, you know, a buddy system or a buddy network is about, and mistake it for getting involved in sort of like, you know, ongoing counselling situation with a person, or debriefing them about particular cases that they might be working with. If someone is needing that, what you would do would be to encourage them to seek out supervision with whoever their regular supervisor is, or you know, if they don't have one, you might be able to assist in pointing them in the direction of someone who you think might be particularly useful with the kinds of concerns that they have. So it's not an alternative to supervision, as I mentioned before. And we also don't want to pressure our buddies into talking about their feelings or reactions. We want to give them the space that, should they want to do that, they can, and they can feel safe to do that, and they know that whatever they say is going to be in confidence. But we don't want to try and put pressure on people that they should or need to be talking about whatever it is that's going on. And of course, being mindful that during this pandemic, there are going to be some specific concerns that, you know, that your buddies are likely to have. The whole fear of becoming infected and, you know, infecting other people, being disconnected from family, friends, and also professional support systems during this time. If you are in an area where you're in lockdown, or that there are significant restrictions on movement, then it might be harder to get you know, regular fresh food, go out and get your shopping, and be eating well and exercising. And of course, we know that in times of stress, that people's sleep can be severely compromised, and we've looked at that in some of the earlier training too, and some of the things that we can do to try and help and support ourselves with getting a good night's sleep if that's being impacted. And of course, there's going to be increased family and relationship stressors too. If you are in situations where you are in lockdown, or there's restrictions on movement, families are spending far more time, physical time, in their homes than they would ordinarily. And of course, that creates just a stressor in itself, having those people around, or, you know, 24/7, and the general concerns that are being added to as a result of the pandemic are going to be increased as well. So people may have greater economic concerns during this time. You know, people losing their jobs, or even if their job is still there, theoretically, because of restrictions in movement, they may not be able to get to work, and so this impacting people's income. And then there's the issue of access to resources, and people's concerns that some groups or areas, parts of the country, or localities within the same area are perhaps got more access to resources than others, and this creates stress for people. And then that's that question that we cannot possibly answer or predict at this time. How long is this going to go on for? We don't know. It will go on for as long as it takes for each individual community and country to manage their particular situation. And of course, it's the whole issue of vaccines is a really big one for many communities and many countries, and who's eligible to get the vaccine right now, and what types of vaccines are available, and where can you get them, and all of these concerns that are going to be increasing people's stress during this time. And of course, being very mindful that for people who may have a history of trauma in their life, and again in earlier training we looked at some of the statistics for trauma, and it's very evident that it's not just something that happens to that group of people out there. It can happen to any one of us at any particular time. And so for those people who are also carrying a trauma history, even when they may have done their own therapy or counselling and really worked with those past issues quite substantially, there is more of a likely that these will get activated as a consequence of the pandemic, and they may be experiencing some of those trauma types symptoms re-emerging, intrusive re-experiencing, hypervigilance and hyperarousal, anticipating grief, or maybe also experiencing actual bereavement, having maybe lost family members with the virus, or that they've lost people who not through the virus but during this time, and all those grief and bereavement rituals that we talked about in part 2 being impacted as a result of the pandemic. And so we may see people who are either more emotional, or they may be more numb, shut down and disconnected as a result of being those past traumas resurfacing as a catalyst with the pandemic. And so how can we help in terms of psychological first aid approach with your buddy? Well, first of all, preparing. The more knowledge and information we have, then the more we have resources that we can offer to that person. So making sure that you have the most up-to-date information in your area, and that it's from a reliable source, so you can share that information with your buddy. And it's not that your buddy wouldn't necessarily know this already. They're going to be most likely keeping in touch with the same things that you are, but being able to kind of just have that conversation to reassure them around that this is where things are in our particular area at the moment. So these are the limitations or the restrictions that we're working within, and this is the trajectory of our situation at the moment. But also to know something about the circumstances of the person that you're offering that support to. And again, this is about respecting people's confidentiality and how much or how little they may wish to share with us. So we don't want to be intrusive, but we also want to create a space where people can share information and know that it's safe to do so. it's not going to go anywhere else. If they tell you, look, you know, my relationship's really under pressure at the moment because, you know, we've got so many people living in the home and we're all sort of, you know, trying to work and do homeschooling and, you know, things that feels like a pressure cooker. People should be able to say those things to us and know that it's, you know, it's not going to be passed on. And also to be mindful of what services are available in your areas, so that if your buddy mentions a particular thing that's going on, you can sort of say, okay, well, look, actually, I know about something that may assist you with that. And, you know, because you may have some information that they don't have, and then being able to pass that on. We want to, you know, use our mental health worker observation skills in this situation, and to be really noticing whether there are obvious or visible signs of distress with the person that we're buddying with. So noticing their body language, which if you're meeting in person or if you're, you know, you're doing that via Zoom, you know, you can key into or clue into those sorts of things. Notice their grooming. Are they presenting in the way that you would ordinarily, you know, expect them to present? Now, of course, if you're having, you know, a network session, sort of like, you know, after hours on the weekend, then, you know, like if someone's just sort of, you know, oh, I've just come in from the garden or I've been doing the housework, you know, we're not talking about those sorts of things, but noticing over a period of time, are there any changes in the way your buddy is presenting? And, you know, is there any sign of sort of like weight loss, or are they looking really tired, or does it seem as though maybe that they're using substances? So really, you know, just being observing and taking that information in. And of course, depending on the person, conversation that you have, thinking about what might be the best way to address what it is that you're observing, and listening to what the person says. What are they saying? What might they not be saying? Are there some things that you think, this isn't quite, you know, I'm not quite getting the whole sort of like picture here? So, you know, really asking the person, exploring, you know, what are their concerns, what are their needs, you know, what kind of supports have they got, and listening very carefully to what their concerns and fears are. Because, you know, remembering from, you know, part 1 and 2, and we talked about if people are distressed, we want to be able to calm them down, to regulate them, to be able to relate to them so that they feel heard, they feel listened to, they feel supported, and then prefrontal cortex will come back online, and then we can start talking to them about problem solving if there are particular issues that do need to be addressed. And, you know, this can involve linking people with particular resources. So information, helping people prioritize what needs attention, because as we know, when we're feeling very overwhelmed and stressed, and there are all these things that need attention in, you know, in our life, whether it's our personal life or our work life, and they all seem important, and it's very difficult to prioritize. And so that can be a very useful practical thing that we can offer to people. It's like, okay, let's just go through, you know, what are all the things that you're concerned about that need to be done? Let's just, you know, brainstorm it, write a list. Don't try and order the list straight away, just sort of like get it all on paper. And now let's think about, well, what order these things need attention to, and help them prioritize what needs attention. And if there is some external support or resource that might assist a person, then to, you know, to help them connect with that if they would like that support. So that's psychological first aid, but there's also taking that a step further what we call therapeutic psychological first aid, which again is not therapy, it's not counselling, but we are providing more as mental health workers, and having those sort of like skills and capacities that we can look at providing therapeutic psychological first aid, if it's necessary or if it would help in a particular situation. And Julian Ford talks about 3 aspects of therapeutic psychological first aid: validating, clarifying, and reframing with a person. So validating someone's perspective and showing respect for their dilemmas. When we're very overwhelmed and upset, we may not be thinking clearly, we may not be able to prioritize, but what will help us step to that point is having the experience of someone who gets it and who reassures us that to be feeling this way is perfectly understandable with what all the things that we're trying to juggle and manage, and clarify with them what their goals are, their long-term and their short-term goals, and these being very much based around their values. So what is it that you feel is a real priority for you, right now, whether it's a priority in their professional life or whether it's a priority in their personal life or a combination of both? Because I think the important thing is that when we think about a buddy network, it's not, we don't want to make an arbitrary distinction between personal life and professional life, because the reality is that they do interlink, and that getting support in one area, there's going to be sort of like benefits in the other two. So helping them clarify those goals, and also to help people reframe, because again, when we feel very sort of like overwhelmed, it's so easy to just focus on all the things that we think that we're not good at, that we failed at, the mistakes that we might have made, and not recognize what our skills and talents and strengths might be. So just sort of like reminding people of that, I know that you're struggling right now, but I also know that you are a very competent and resourceful person, and we're going to work this out, what might be the best thing to do right now. Creating the goals for therapeutic psychological first aid are creating a sense of safety, and we can do that by reframing the person's fears and concerns as normal. It makes sense that you're feeling like that right now. Anyone will be feeling upset or angry or frustrated or fearful. And so listen to those concerns and help them to identify that, in those concerns, what are they doing to help themselves and keep other people safe. We want to help create a sense of calm, and we do that by allowing people to explore to a degree some of the fears and to talk about them, to not shut the person down from talking about those things. But we don't want to just keep opening them up, because remember, this is not therapy, it's not counselling, but we are creating a space where we are creating an environment for the person to become reflective, to move from their distress, their anxiety, into being able to reflect more. Okay, getting clearer now that I'm really sort of like stressed about this, and so maybe doing that will help me manage my anxiety or whatever it is that's happening. So a space for exploration, and then move to reflection. We also want to help people tune into what their strengths and capacities are, and what they are doing, what they are contributing to their own health and safety and well-being as well as, you know, family, community, clients that they're working with, their colleagues. And so sometimes what people might be doing to assist can be very simple, like simple things as keeping themselves isolated. I know that you're feeling really stressed, that because you're not at work, that other people are needing to take up some of your clients and that you're worried about that. But right now, the best thing that you can do for your colleagues, for your clients, for your community is to isolate until you've got your test result back and that you know for sure one way or another whether you're you know, you're positive or negative. And so it's really kind of like helping people at times do what they know that they need to be doing, but they may, for whatever reason, feel unsure about it or be worried about an additional responsibility that it might place on other people if they're doing something that they need to for themselves. And sometimes just taking some time out. You know, I know that you've got a lot on right now, and it might feel as though it's really difficult to take some time off, but you know, it might be your own health and well-being. It might be just a good idea to take a couple of mental health days and just give yourself some space to rest, to focus on yourself or your family or whatever it is, and not take on the responsibilities of, you know, of the world. Work will still be there when you get back. You do what you need to take care of yourself. Sometimes we just need to hear that from someone else, giving us permission to take some space and time out. So giving that space for, you know, we are being compassionate, we're being empathic, we're going on that journey with our colleague, understanding what they're thinking, what they're feeling, to help them, you know, make some choices and decisions for themselves. So it's not our job to take that decision-making process away, but we are just kind of like that sounding board. And often when people start to say things out loud, it can click into place. And so just having someone there to sort of like listen can be incredibly beneficial. And also it's about creating a sense of hope for people, where we help them. You know, it was when I was talking earlier on in the training, in terms of organisation, focusing on the wins and the successes that, you know, an organisation or a team within the organisation or an individual within that team might have had. That it's like, yeah, okay, you know, this might feel like an overwhelming you know, situation right now, and you know, if we had to deal with it all on our own, it would be just completely overwhelming. But when we think about the small things that we can do every day for ourselves, for other people, that aren't about fixing it for everyone, but I guess, you know, just doing the right thing, living by our values, being considerate, maintaining our physical distance, even though we may want to go and call in on a friend or a neighbour, but knowing, hey, you know, I really want to do that, but that wouldn't be fair. And other people are not doing it, so I need to do the right thing too. So making people, helping people be more in touch with those things that are really important in terms of creating hope, seeing the small steps in the longer journey. And of course, we don't want to be just offering you know, reassurance or false encouragement. Oh, look, you know, it will be over soon, I'm sure by, you know, next month or the month after, you know, things will have really quietened down. We don't want to say things that we don't know are fact and truthful. It's more about reassuring people that they've got supports, that they can call on us, that they can connect with us when they need to, and that they're doing the best that they can in a very difficult situation. And it can also be helpful in terms, and this was when we looked at setting up a buddy system, and how can you make those connections with people sort of like, you know, meaningful, right? So that it doesn't just sort of like be a, you know, oh, how are you going? I'm fine. How are you going? That you can create a bit of a structure where you might go through a process like this, where you invite your buddy to reflect on a moment that was incredibly stressful or challenging since the last time that you spoke. A moment that was either very high or low in terms of emotional intensity, and it might be that they, you know, that they just felt really just sort of like highly stressed and overwhelmed, or feeling like they were falling, you know, really into sort of like, you know, a flat, and it was a situation that created some sense of sort of like despair or hopelessness. To reflect on a moment that was very inspiring or poignant in some way since you last met. Think about something else, one thing that someone else did that made a difference, whether it made a difference directly to themselves, or it made a difference for someone else that they, you know, they observed and that they witnessed, and that was, you know, an important moment for them to be part of, and for them to think about something that they did that has made a difference. Again, I think that we can be kinder about other people and their achievements and contributions, and it might be harder to acknowledge the things that we have done that have contributed, but for them to really think about you know, something that they did that really made a significant you know, difference to someone. Might not have changed, you know, everything, but in that moment it really helped another person. And you know, what is a value that they are striving to uphold? What is something that's really important to them, that in terms of getting out of bed in the morning and doing all the things that, you know, we do every day in our lives, that it's important that they pay attention and be mindful of a particular value, and to think about one thing that they're going to do going forward. What can you do between now and next week, or a couple of weeks' time, or whenever it is that we meet again, that will help you or support you in some way? And then, you know, like if you've done this kind of reflection with each other, the next time you meet, you can just sort of like see, well, okay, what that thing that you said that you were going to do, how did that go, and what difference did that make? So these are the kinds of things that we can offer each other in a buddy network. And so if you're not part of an organisation, you can also do these you know, buddy networks from a private practice, because you know, you will have colleagues that you know, that you are in connection with, whether they're in the same town or even in the same state as you. It's not so important, but to, you know, to maybe sort of put out some ideas if you're part of a peer supervision group, or, you know, or network, and table the idea of, you know, how about we set up a bit of a network system, and who might check in on who, or you might have one particular colleague who you think this might be, you know, a good thing that we can do with each other, remembering very clearly those boundaries, that it's not supervision and it's not counselling. It's about supporting each other through this very challenging time, and hopefully it becomes something that you just do moving forward once the pandemic has passed. If you are the person that's providing the support, it's important to be mindful that you're going to be going through very similar things to the person that you're buddying with. And so you need to also just be mindful of, you know, what you you can and can't do, what you can and can't offer, and not to feel as though if you are struggling, that you can't tell your buddy this because you know that they're struggling as well, because that sort of like defeats the purpose. This is an opportunity to be with people where you can really just be open and honest about what it is that you're both going through, and to so be really clear on your own boundaries and limits of what you take on. That this isn't about, you know, saving or rescuing other people. It's about making connections and supporting each other in the best ways that you can. Because ultimately, and I love this this quote, I often use it in different types of training that that I give. This is sort of like the final thing that I would like to put out there for you in terms of creating buddy systems, supporting each other during this very, very challenging time. That the creation of safe places for sharing, where the unspeakable can be given voice, where feelings can be felt, and where sense can be made out of what seemed previously senseless. So thank you for joining me in this 4-part series. I sincerely hope that you have learned some things that are going to be useful to you over, you know, the coming weeks and months, that will support both your clients as well as yourself, and as well as each other. It's been an absolute pleasure and privilege for me to be able to you know, offer this training for you. I know that I can't see you, but I know that you're out there, and I'm thinking of you. And please stay safe, and I hope to see you another time. And until then, take care of yourself and each other. Bye for now.